If you or a loved one is facing kidney failure or is currently on dialysis, you might have questions about a potential kidney transplant. To understand everything involved in this life-changing procedure, join us on the Roadmap for Kidney Transplantation, Part 1. As we navigate the journey ahead, you'll hear from a transplant nephrologist and a transplant coordinator who help support patients before and after kidney transplant. We'll also discuss the process to receiving a kidney from a living or deceased donor. The kidneys are bean-shaped organs, the size of your fist, on the left and right side of your spine. Your two kidneys have many jobs, from acting like a filter to remove waste and extra fluid in your body, to keeping bones healthy and making a hormone that controls the production of red blood cells. The kidneys also help control blood pressure and keep the right levels of electrolytes. All of these jobs make the kidneys essential to keeping the body working as it should.
When your kidneys can't support you anymore, we call that end-stage kidney failure. And there's two options for treatment. One is kidney dialysis, and the second is kidney transplantation. Kidney transplantation is generally considered the better treatment for most patients with kidney failure because it's associated with both a better quality of life and a longer life.
Kidneys are the most common organ transplanted in the United States. There are over 2,200 patients in Ohio waiting for a kidney transplant. On average, 1,200 people receive a donated kidney each year. Patients of all ages, from children to seniors, can get a transplant. Donated kidneys can come from a living donor, such as a family member, friend, or stranger. They can also come from a person who has died and donated a kidney, which is called a deceased donor. In Ohio, the average wait time for a deceased donor kidney is 3 to 5 years. The timing is considerably shorter for a living donor kidney.
There are currently 6 adult and 2 pediatric transplant centers in Ohio. They are the Cleveland Clinic Foundation and University Hospitals of Case Western Reserve in Cleveland. Columbus has Ohio State University, the University of Toledo Medical Center in Toledo, and there's 2 centers in Cincinnati, Christ Hospital and the University of Cincinnati. Pediatric centers are currently in Cincinnati and Columbus. Most patients will choose the center that is closest to them. However, it's not uncommon for people to be on multiple lists and look at multiple centers.
Getting a kidney transplant is a journey that includes many stops along the way. Once you start the process, your team of dedicated healthcare professionals is there every step of the way. Here's how the process works. Stop 1. Referral.
A person can be referred to a transplant center several different ways. They can call on their own, they can be referred by their primary doctor, or their dialysis center can refer them. Following the referral, someone from the transplant team will contact the patient, ask initial screening questions, and request records from their doctor. A thorough evaluation of financial coverage is done ahead of time as well.
If you need help collecting the requested information, ask your social worker. Prior to scheduling an appointment at the transplant center, it's a good idea to understand what is going to happen over the next few months to years. Stop 2. Self-education. The best way to navigate this path is by educating yourself. You'll hear many new medical terms, abbreviations, and acronyms. Review educational materials provided by your transplant center or talk to someone who's received a kidney transplant.
Patients seeking a kidney transplant receive a lot of education. There's a thorough explanation of evaluation process, what it takes to make a decision about the option of transplant, what it is like to be on the wait list, what the hospital stay is like during the transplant, and what life can be like after the transplant. This is a life-changing process and surgery, and we want patients to know what to expect as much as possible. They will be asked to sign a consent that they have received this education and that they want to proceed with the process, and they'll have an opportunity to ask any questions.
This is one of the most important stops on the path to transplant. Stop 3. Testing and evaluation. The purpose is to see if a kidney transplant is a safe and helpful option for you. Once your medical insurance provides approval, testing can begin. Most transplant centers will schedule you for at least one full-day evaluation appointment. You will be asked to bring a family member or friend as a support person. At this first appointment, you'll meet your transplant team.
There are many people who work to make a transplant successful. Each person on the transplant team is an expert in a different area. This team includes all or some of the following professionals: Transplant Coordinator, Transplant Surgeon, physicians including several specialists, a social worker, financial coordinator, dietitian, and a transplant pharmacist. The patient's primary contact is the Transplant Coordinator. The coordinator is the hub of the wheel. This is the person that the patient will call first who will help to direct them. They are the connection to the entire transplant team, and their job is to keep the process moving.
After meeting the transplant team, blood tests are needed to look for general health and disease. Doctors analyze your blood type and chemistry. They also use this information to see if a potential donor kidney is a good match for your body. You'll undergo medical exams to ensure you are healthy enough to receive a new kidney. These will depend on your specific health conditions and may include CT scan to see your liver, gallbladder, and kidneys, cardiac test, such as an echocardiogram, stress test, or cardiac catheterization to ensure your heart is healthy, cancer screening, pulmonary function tests to check the function of your lungs, colonoscopy to screen for colon cancer, and dental evaluation to check your teeth and gums. After blood work and medical tests have been completed, the transplant center will evaluate all of your results. The hospital will contact you if they have any follow-up questions or with the next steps in the process. In the meantime, talk with your social worker or nephrologist if you have any questions or concerns. It's a good idea to notify your transplant coordinator if your health or medical insurance changes at any point during the process. Stop 4. Selection Committee. Once testing and evaluation is complete, those results are presented to the Selection Committee.
The transplant centers are mandated by governing bodies of transplant to have what's called a selection committee. This is a group of transplant professionals who will evaluate the patient in various domains and then make a decision as to the suitability of that candidate for transplantation.
If the transplant team determines that you are a candidate for transplant and you complete all steps of the patient evaluation, you will be added to the waitlist and considered an active candidate for kidney transplant. Stop 5. Transplant waitlist.
The timing of a transplant is very unpredictable. I describe the process as hurry up and wait. The patient hurries up to get the referral done, waits for the evaluation to be completed, then waits to get the appointment scheduled and done. Then the person waits for those results. If someone is placed on the wait list, then there may be more waiting. During this time, there is ongoing management with the transplant team, who checks in with the patient and reassesses the individual on a yearly basis. We want this person to remain as strong and healthy as possible before the transplant. However, there are options like having a living donor for a kidney that can help to speed up the process. Patients who opt to use a kidney from a deceased donor have to wait for the organ to become available. This is because there are more people who need kidneys than there are kidneys available. Average wait times for deceased donor transplant vary from center to center. The waiting continues as the patient waits for the call to come from the transplant team. When that call comes, the person has to be ready. This call can come at any time and can be a very emotional process. A transplant from a living donor can take from a couple of weeks to a couple of months. It's a good idea to begin the search for a living donor as soon as the patient knows they need a kidney. Time on the wait list can be significantly decreased if the patient has someone who is a match and willing to donate. Receiving a kidney from a living donor can allow the recipient to have a better outcome.
Stop 6. Receiving notice of kidney transplant.
The United Network for Organ Sharing, or UNOS, is the regulatory organization for transplant centers. They lead the network of transplant hospitals, organ procurement organizations, and thousands of volunteers who are dedicated to honoring the gifts of life entrusted to them and to making life-saving transplants possible for patients in need. UNOS helps to ensure patients have equitable access to transplant by maintaining a database that contains all organ transplant data for every transplant event that occurs in Ohio and across the United States.
When UNOS matches you with a kidney, you will receive a phone call asking you to come to the transplant hospital. A kidney from a deceased donor has to be transplanted in 1 to 2 days, so the process will move very quickly.
Once you're activated on the wait list, we ask that you always maintain accessibility because you never know when that phone call is going to come. We may call several patients for each kidney, and you may serve as a backup. If that kidney doesn't work, you don't lose any place on the list, and you may turn down a kidney and not lose any place on the list.
People with advanced kidney disease may seek a transplant at any point in their journey. The sooner you start the process to receive a transplant, the better your long-term health outcomes. If you or a loved one has questions about any of the information we shared, talk to your nephrologist or contact the Kidney Foundation of Ohio. Continue this journey by viewing the Roadmap for Kidney Transplantation, Part 2.